My apologies. I'm sorry for being late. I was having a little computer challenge this evening. Glad to see all of you on and welcome back. Welcome to 2024. I hope everybody had a wonderful holiday, enjoyed your Christmas season, and now we're back at it. So if everybody's ready, set, go, we'll get the evening started with our opening prayer, and I'm going to ask Erin to assist us with that, please.
All right. Good evening. Heavenly Father, we thank you for this day. We thank you for bringing us through 16 days in 2024. We thank you for all you're about to do in 2024. May we have new beginnings, new start, new friendship, new business, and may all the participants this year gather information on the prevention, treatment, cure of cancer. Lord, we thank you this day, and we bless our speaker that will be bringing us a very important message tonight. And may we learn so much that we imparted with our family and friends. We thank you and we ask this in Jesus' name we pray. Amen.
Amen. And thank you, Erin. So once again, welcome back, everyone. And before we get into tonight's speaker, just want to know if anyone has any special events they're celebrating, birthdays, anniversaries. If you had a birthday since we've been on break during the Christmas, let us know so that we can celebrate you. You can either unmute your mic and let us know, or you can raise your hand or put something in the chat. But let us know so we can celebrate you. No celebrations? Sorry?
Anniversary.
Oh, anniversary. When? Tonight?
No, on the 25th. Number 16.
Oh, okay. Well, congratulations. We celebrate them all. We don't let any of them pass here. As long as you're not too shy to let us know, we help you celebrate. Oh, where'd I go? Hello? Am I still here?
We can hear you.
Oh, okay. I don't know what happened to me. I'm not seeing anything on my screen. Oh, I am having so many challenges with this computer today. Anyway, I'll work through that. While I work through that, I will ask Omega to give us some, if we're done with all the celebrations, if Omega can update us on any announcements, upcoming events in January.
Good evening to all. Can everybody hear me?
I can.
Yes.
Okay. Good evening to all once again, and Happy New Year. Let's get into the Cancer Society's upcoming events. If you're anything like me, you love a good sale. So our thrift store is having an end of month sale. Lots of stuff will be marked down, items as low as $1. And at that time, you can probably get a sneak peek of new arrivals as well. Speaking of a sale, our Stride for Life walk is scheduled for February 24th, but we have an early bird special registration going on right now where adults are $25 and kids are $15. It's going on right now. You don't want to miss it. It ends January 31st. You can register online on our website, cancersocietybahamas.org, or you can come into the office and register, okay? You don't want to miss the sale because the prices after January 31st, the price will go up for adults $30 and kids will be $20. So if I was you, I would save a few bucks and get on that early bird special registration, okay? Last but not least, we start back up with our annual PAP and PSA campaign on the islands of the Bahamas, and we're going to start on the beautiful island of Eleuthera. where we'll be doing free screenings such as pap smears, breast examinations, and PSA testing for the men at Rock Sound Clinic, Hatchet Bay Clinic, and Palmetto Point Clinic. Okay, so if you know anybody in Eleuthera, tell your friends, your family, share the word. Cancer Society will be doing free screenings at 3 clinics in Eleuthera. You want to take advantage of that opportunity. Thank you.
Thank you, Omega. Boy, that's some good news. A sale, a discount, and free. Boy, nothing Bahamians like more. So we got 3 out of 3, so don't miss any of them. All righty, and if you're in Nassau, please do join us on the Stride for Life walk. The more, the merrier, and it really is. We always have a great time. Lots of prizes and surprises. So be sure to join us, and that's February 24th, like Omega said. So now we will move into the meat and potatoes of tonight's meeting, and tonight we are discussing cervical cancer, and with us to give us some information on that is the very world famous Dr. Homer Bloomfield. And Dr. Bloomfield, I have a whole long bio for you, but I know that I probably don't need to read that because I think everybody on here probably knows you and knows you well. I met Dr. Bloomfield when I joined this board many years ago, and he had served on the board many years before I joined. So he has a number of accolades. He may share some of them with you in his presentation, but he's certainly no stranger to the Cancer Society. We appreciate all his work over the years and all of the work that he continues to do with and for us. Did you all know that he was the first Susan Andrews recipient? That's quite an accolade, I'd say. So many honors over the years, and his work has afforded him the opportunity to represent the Bahamas on many trips to many countries in the Caribbean and around the world. So he loves his work, and it has certainly shown over the years. So before I get carried away with that, just showering him with blessings, I'll just let him take the stage right now. I won't upstage him. So Dr. Bloomfield, over to you, and thank you.
Thank you very much. Now, this is a challenge for me. This is my first time doing this. So once I get started, then I'll be able to hopefully get going.
Okay, you're doing a great job because we can see something on the screen.
Okay. Now you can see me?
Yes.
Okay. All right. Now we're gonna get started. So the first slide says cancer to cervix, enhancing awareness. Can you see that?
Yes.
All right, okay. Now, this is indeed a pleasure for me to join you once again. Unfortunately, sadly for you all, this is my first Zoom meeting. So the next time I'm invited, I'm gonna be asked, is this in person or Zoom? If it's Zoom, I'm probably gonna say no.
Oh, you're going to be a pro after tonight.
I hope so.
Doing good.
All right. Okay. So tonight we're going to talk a little bit about enhancing the awareness of cancer of the cervix. And it is the cancer that allowed me to become a part of the Cancer Society. All right. Now, every time I give a talk, I show this slide. And I remind everybody, the Bahamas geographically is difficult to monitor and treat any disease condition because these are chains of islands separated by miles of sea. Now, if you get on the sea, it's beautiful, but to move from one place to the next, it takes quite a bit of effort. And certainly if one lives in Nassau and you have a problem, you can probably get it treated effectively and quickly. But if you live down in Agua or Crooked Island, you probably need to be transported to Nassau. so that you can get yourself sorted out. Now, one of the things that I comment on all the time is that a lot of the people that we serve are, and I say this truthfully, I know I have a Bahamian passport, so I can talk now. We are an ungrateful bunch, all right? Because the scenario I paint all the time, if you're down in Inagua and something happens to you, oftentimes the government of the Bahamas will arrange for a plane to come down there to get you and fly you into Nassau, and you get the treatment. And rarely do they ask you for money when they get there to pick you up. And they take you to the Princess Margaret Hospital. You know, we get a lot of criticism about the Princess Margaret Hospital, but it's what we got. And we have had a lot of good work done there, and a lot of people's lives have been saved there. But the people continue to complain that, you know, for better or for worse, they know they got treated, but they wish they probably didn't come. So until something else changes, I will remain grateful, and I'll still encourage people. It's better in the Bahamas. All right. Now, when I first joined the Cancer Society and I started giving these talks, the population at the time was 214,000. So since then, we have almost doubled that. The languages and ethnic group has not changed much. Birth rate, death rate, just about, you know, satisfactory. Male life expectancy has probably fallen a little bit. Female life expectancy has gone up. And infant mortality, we wish it was better, but it's probably better than a lot of parts of the world. But this is what we have to deal with. So the current population is approximately 412,623. And I show this again. This is the life expectancy. Now, we all know that cancer of the cervix is a sexually transmitted disease, and it's caused by a virus called the human papillomavirus. And the significant contributor to this condition is they're numbered 16, 18, 31, 33, 35, 45, 52, and 58. And believe it or not, this is a preventable disease because it is a sexually transmitted disease. And despite the fact that it's a viral infection, the significant thing about the cervix is that it gives you warning. And it progresses from normal to abnormal almost in sequence. And typically it takes about 3 to 10 years for cervix, even after being infected with the HPV virus, to go from normal to cancer. Now, most people infected by the HPV virus will quell this, and they have no sequelae. Unfortunately, there are few, for various reasons, may get changes on the cervix that could ultimately lead to cancer of the cervix. But again, it's preventable. And I'm going to teach you a couple of the tricks how to do that. So, as with most cancer, screening, early detection, and treatment. And unfortunately, it still remains the leading gynecological cancer among Bahamian women and ranked number 2 behind breast cancer for malignancy. And it accounts for about 10 to 11% of all deaths of female malignancies. Now, who are at risk? Typically, it's people who are sexually active, because I said it's a sexually transmitted infection. And the age group that is typically at risk is between 21 and 65, probably a little bit older, because some people 65 are still sexually active. But they just going from the census figures of 2023, and with me doing a little adjustment and stuff, the population at risk is about 137,000. Now, do we get those people investigated on a regular basis? The answer to that is no. Because I reviewed some of the presentations I did before, going back to the early 1990s, and it seemed as if, even though if we rule out the COVID pandemic years, we are doing probably less pap smears than we did back in the early 1990s. So my talk tonight is we're gonna have to start over. I think it's important that we don't abandon what we're doing, but we have to find a way to do it, a better job of doing it. And this is the data I got, quick collection. I went to the Princess Margaret Hospital, and the tests, pap smears done through the hospital 2022 was 1,804 in 2022, in 2023, 1,377. One of the private labs, I won't name it, from January 1st to 2021 to January 1st, and remember this included the COVID years, was 14,698. Another private lab, 2022, they did 550, 2023, 5,000. And I managed to get from one of the labs at the Cancer Society in 2022, 400 cases, and last year, 230. Now, a number of pap smears are sent abroad and are evaluated. We never, from the earliest beginning, we have never been able to truly identify this group as to the numbers. But again, like I said, if we add this up, it is nowhere near the 20,000 mark that we used to do back in the early and middle 1990s. And this is figures that I got from an old slide. And this is what it was. 6,000 in the public clinic in 93, 8,600 the private clinic. And you can just scan down the list. And again, it was pretty close in this. It was about 17, 18,000 a year. Plus, if you add on the one sent abroad. So this is an area that we must improve on. We need to screen more people. We need to let more people add themselves to the list. And this again is some of the testing that we did, again, showing you the numbers. These are the pap smears done, and some of them with the abnormal pap smears and the normal ones. Again, numbers far overruns what we are doing now. These are numbers on the abnormal pap smears again, 1995 to 1990. And you can see that there's squamous cell carcinoma abnormal, even odd one, adenocarcinoma of the cervix, which is extremely rare, but also possible. This is another one again through the public sector. Again, you can see the figures. Now, in the Bahamas, approximately 35 to 45 females are diagnosed annually with cervical cancer, and approximately 28 to 30 women die annually. Now, this 28 to 30 is not the newly diagnosed group. This is people who probably have been affected for a period of time and have subsequently came to the end, the ultimate end of what this disease can do. But in my experience being in the Bahamas, for the time I've been is over 40 years now, I have met people. There's one particular lady that I talk about all the time. 37 years ago, she was diagnosed with cervical cancer, and we sent her to Miami for treatment, radiation, because she had advanced disease, and she's still alive today. At the time, she had a 4-year-old daughter, and she was worried that she was probably going to die and leave that little girl behind. That little girl now is a grown woman and is a practicing physician in the United States now. So again, it shows that if you're being treated, diagnosed, and you manage yourself, you can survive. And she has no sequelae of the disease. If you saw her now, you wouldn't be able to tell. Now, this is just a little reminder of what the female anatomy is all about. The uterus, and at the end of the uterus, joining onto the vagina is the cervix. And that's the area that we'll be talking about tonight. As I said before, the infection is due to the HPV virus. And when HIV was more common, I always had to point out the difference. It's the human papilloma virus and not HIV. And it's a disease related to sexual activity, reportedly a sexually transmitted disease. So people who have never had sex, they're very unlikely to get cervical cancer. And even people who have been infected with the virus, are affected by the virus, most women or men will clear this virus without any sequelae. People, of course, with altered immune states are more susceptible. And of course, there are other confounding variables that can push you above the edge. Now, even though I said that the progress from normal to cancer is about 3 to 10 years, this doesn't apply to everybody, okay? So there are certain things that we look at. People at greater risk, people who begin to become sexually active at early ages, people with multiple sexual partners, people who have had a lot of children. Now, it doesn't mean if you have 12 children, you're at any greater risk than somebody if you had only one partner and that partner was you were that partner's only partner, then you straight. And of course, before the HPV virus was identified, it was recognized that people with cervical cancer were people who were often infected by the various sexually transmitted diseases. And at one time, herpes simplex, the virus, was blamed for cervical cancer until the HPV virus was identified. Worldwide, this continues to be a major problem, and approximately 500,000 people are affected with cancer, not abnormal pap smears, annually, and about 250,000 die each year worldwide. Of course, most of the deaths takes place in the socially deprived regions. Genetics is sometimes blamed, but there's not too much evidence for that. And of course, because we live in this part of the world, there's often identified the difference. Is there blacks get it more than whites, non-Jews more than Jews? When you look at the data though, poverty seems more likely than race. In other words, people who are socially deprived, people who are involved in devious sexual activity, the risk remains just about the same, whether you're black or white. Interesting fact, and this is where now we start making the changes. Most women presented with cancer of the cervix have never had a pap smear. Many women presented with cancer of the cervix have not had a pap smear for more than 5 years. So back in the days, we used to get people, again, you ask them, have you ever had a pap smear? No. Or yes, when was the last time? When I had my last boy. How old is your boy? 19. Okay, so this is the kind of news that we used to get back then. And of course, they often presented with signs and symptoms which often indicate that it was advanced cancer. The death rates are high in older women, like most things. And like I said earlier, invasive cancer develop often 10 years after failure to detect and treat early non-invasive lesions. And early disease is often asymptomatic. In other words, when you begin to get symptoms that you can correlate with the possibility of cervical cancer, it usually indicates that there's established disease. So by and large, there's very little change when you get the early changes, that the precancerous lesion. I put this up before, and again, like I said, the HPV virus is the reason for the cancer of the cervix. The common one, 1618, number 16, accounts for about 60 to 70% of cervical cancer. The other ones to a lesser degree. And of course, in certain territories, different islands or regions, the HPV virus implicated may be different. Currently, there's almost 200 types of the human papillomavirus. And about 40 of these, they actually so numerous, they number them. About 40 of the numbers affect the genital area: the vulva, vagina, cervix, rectum, anus, penis, scrotum, as well as the mouth and throat. So again, it indicates sexual activity, screaming out at you. This is a kind of busy slide. Not all HPV infection are malignant. Some of them are benign. And like I said earlier, most HPV infection don't lead to cancer because most people will clear the virus even if they contract it. And of course, I mentioned before, you can get cancer, the anus, penis, vulva, vagina, cervix, back of the throat, all right? And these are links through sexual transmission. Now, the good news, vaccine can help protect against the strain of HPV most likely to cause genital warts or cervical cancer. Now, our experience during the COVID pandemic leaves us with a lot of challenges, good and bad. Now, the vaccine is, besides screening and being tested and treated if you do contract the virus, the vaccine offers protection. But if we're going to administer the vaccine in the same manner like the COVID vaccine, then you know you're up against some real resistance. All right. Because for one, the HPV vaccine is recommended at an early age in children. And of course, the different vaccines are for females only, or male and female. And we discussed that as we go a little further in the talk. This is what the HPV virus looks like under the microscope. And this one says more than 100 types. Is probably, this was an old slide. So we now, like I said, we're close to 200 now. And of course, you have the anogenital ones that causes cancer, oncogenic ones, and I gave you the numbers before. And of course, you have the non-oncogenic ones, like that are associated with warts, number 6 and number 11 are the predominant one. And those never become malignant. And just another little business slide showing you that 16 and 18 are associated with cervical cancer, abnormal changes on the cervix and the vagina and the vulva. And 6, 11, 16 and 18 can also cause changes, even though, again, like 6 and 11, it will cause an abnormal pap smear, but these will not go on to malignancy. And of course, 6 and 11 are responsible for most of the genital warts. And this is just some of the lesions, benign lesions caused by the common wart, the HPV 6 and 11, and they can be all over the body. Contact is the problem. Now, our saving grace came back in 1943. George Papanicolaou and Trout came up with this classic work on the diagnosis of uterine cancer by getting some vaginal smear. So they got some fluid from the vagina, they scraped the surface of and they realized that they could identify abnormal changes on the cells of the cervix. And it then became predictable that these cells, if not stopped, will continue to change and become malignant. And because of their work, it has decreased cervical cancer by more than 70%. But the main reason is you have to get tested. In other words, there's no point getting a pap smear when you already have the disease, when you have cancer of the cervix. So you want to find this early and before you get pre-invasive lesions. Now, this is basically what a pap smear looks like. You're looking at the cervix and they scrape these cells off, and this is what the cells look like. You can see the normal ones, what they're supposed to look like. So under the microscope, you can actually tell when the cells are abnormal because they don't look like the normal ones. And as you go around from the top, normal, inflammatory, precancerous to cancerous, you can see the significant changes markedly with the nuclei of the cells. And they certainly look different from the normal ones. And I give credit to Judy Ward Carter, who I used to argue with in the histology lab when I came to the Bahamas first, because I couldn't understand why there were so many cancers of the cervix. And so I used to go down there. I thought maybe they weren't reading the slides properly. And of course, she showed me these slides so that I learned to actually read cytology cells from her. And then she was the one who got me interested into becoming a part of the Cancer Society. And I've had no regrets. Now, I put this in often as a joke, and this is why I prefer an audience, because I can explain this better. I wish every woman had a prolapsed uterus and cervix like this. These often occur in the elderly, where the womb, literally called the womb falling out. Because if this happened, you could do your own pap smear. You could do your pap smear, scrape the surface of the cervix, and then push it back, and you'll be straight. Because that don't happen, then we have to go to the pap smear, the routine, what we do as a pap smear. And this test, the hallmark of it is it's simple to do. It gives you, it's acceptable to most people once they commit themselves. It provides a fair degree of accuracy. It's relatively low cost, highly sensitive, and highly specific. So if it denotes the possibility of malignancy, you can literally back this up scientifically. And you know that if you get these abnormal cells from a pap smear, then you are facing the possibility of you becoming infected with a malignancy. Now, to get people to do a pap smear is another story, but I think I seen listed on the government data that about 60 to 70% of the Bahamian population has had at least one pap smear. I pray that that is true. But the important thing is to get followed up, that you need to get this repeated, and in a specific manner, okay? We're gonna discuss if and when you can actually stop doing pap smears. Now, this is how you do a pap smear. Put the speculum, the dreaded speculum. And when you look inside, you can actually look at the cervix. And this is what a normal, healthy cervix typically looks like. Pink, smooth surface and stuff. And if you look inside the cavity, you notice the cavity looks a little different from the surface. The surface tends to be shiny. And then within the cavity, it has a deeper tone. And that's because the cells in the canal is slightly different from the surface cells. But it's right in this region, the junction between the shyness, the squamous cells, and the endometrioid cells, that you get the malignancy. All right, this is another look at another normal cervix, smooth, pink, and stuff. Now, you can see this one look different from the slides I previously showed you. All right, this is not cancer. This is one that's with inflammation in it. And again, looking at this, if we start at the top in the left, you can see one with inflammation, Nabatean cyst, those little blebs that you see. Then you can see one with fungus, that white stuff. And then the one to your right at the top, you can see that string. That's actually somebody with an IUCD, intrauterine contraceptive device, the coil. Bottom left, that's actually a fibroid that's coming out of the cervix. In the middle of the bottom, these are polyps. And of course, right bottom, this is what a malignancy can look like. So again, simply putting the speculum in, you can get a fair idea as to what. Of course, you have to do the test and do the biopsies to get that. Now, this is what cervical cancer look like. Certainly don't look like what I showed you earlier. And of course, the one at the bottom right is the worst case. This is when the material literally start to break down. This is when you get that bloody, smelly discharge and stuff. And as I said in previous meeting, we have people, movie stars and stuff will come on and advocate for breast cancer, colon cancer, but nobody's going to come on and advocate for cervical cancer. Again, because of the nature of the implication as to who and when you get cervical cancer. Nobody's going to come on and proudly say that I have cervical cancer, whether they were treated or not. So we have to be vigilant and we have to lend ourselves to the testing. The at-risk group, all sexually active females. So if you're not sexually active, then you don't need a pap smear, okay? And the highest at-risk group is 18 to 65. Now, about 20, 30 years ago, we learned some real interesting lessons. In the early age group, we often would get these abnormal pap smears and we would go about biopsying. And if we had simply just left these people alone, most of these would fix themselves. In other words, there are other reasons why you can get an abnormal pap smear outside of the fact that this is a precancerous lesion. And so we had people, unfortunately, got biopsied so much that they had very little cervix left. Now we learn just to observe, and we can test for the HPV virus. And if we find it, then we surveil these people even more. All right, early sexual activity before age 18. These group are most, and of course I mentioned multiple sexual partners. Females whose sexual partners have multiple partners. So you may be the only person, but if your partner is having sex with a lot of people, then they're likely to bring the the HPV virus home, just like they can bring HIV. And of course, people with history of sexually transmitted disease, especially HIV. Remember, HIV damage immune system. So if you have a damaged immune system, people who normally would probably have fended off the HPV virus naturally are at greater risk. And high priority, like I explained earlier, doesn't necessarily mean if you have a lot of children, you're at risk. If you have had, a steady partner, and of course you don't fit in any of the above bracket that is mentioned. Now, ACOG recommends that the first pap smear should be done when you become sexually active or by age 21. Now, I don't know too many persons who will be pushing somebody over 21 who has never had sex to do a pap smear. And of course, after that, it should be yearly for life. Now, these things change from time to time. And one of the things that I encourage my patients to do is to have a pap smear every year, because I am often my patient's only physician until something else happens. Now, if I tell them they don't need a pap smear annually, you can come, if your pap smear is normal, you can come back in 3 years. I can guarantee you that more than 50 to 60% of them, I probably won't see them for another 6-7 years. Because a lot of them come and they come for a pap smear. And of course, that's when they get the blood works done, mammogram, physical examination, and other appropriate testing at the time. Others contend that monogamous women with no history of abnormal pap smear can have their pap smears done every 3 years. Emphasis on monogamous, all right? So again, you got to be monogamous, and your partner also has to be monogamous. And of course, if you have had normal pap smears, then every 3 years can be fine. But you must, what I tell my patients often, even if you come every year and I don't have to do a pap smear, I can always take a look at the cervix. And even without, we can take a look. If there's need, it looks suspicious, then we can do a pap. But, safely, if you fall under that guideline, you probably don't need a pap smear done. The same thing probably applies to people who have had hysterectomies, all right? Again, it must be no history of abnormal pap smears. And a lot of people can't prove that, because a lot of them had the pap smear probably just before they had a hysterectomy, or historically they only had 2 pap smears in their 45-year lifespan. Now, the people at risk are, again, the uninformed, the isolated, older patients, and in the Bahamas, immigrants. And this is an old slide. And those who live in the lower socioeconomic circumstances, they have limited access, because to getting a pap smear done, you got to take off sometime for a day, get to the clinic, and of course, you got to wait your turn. And of course, even though most clinics do these for free, if you want to get easy access, speeder, turnaround, you probably have to go to a private clinic. But the results, the turnaround time typically now is pretty quickly, in 72 hours. Most of the standard labs will have your pap smear back within that time. And of course, we have to focus on these groups. And this is where I think that we have fallen down in many respects, because the above listed are still outside of the sphere. And a lot of the pap smears that we do when we count the numbers include people who are having repeat pap smears during that same year. So let me just give you a little summary of what happened to me and why I got involved with this. I came to the Bahamas in 1981, joined the OBGYN department in 1982. And what struck me was we had women who had lots of children, never had a pap smear. There's a lot of them. Some of them didn't even know what a pap smear was. And many of them were presenting with abnormal disease, and of course, with obviously poor outcome. Back then, pap smears were primarily done in Nassau and only at the hospital clinic, because these were the days before the 5 major clinics were built. All right. This was on the Blue Hill Road, and Coconut Grove was around, and Anstown. Those are 3 clinics. And I guess if you had your postpartum check, you'd get a pap smear done. But most people didn't come back for the postpartum check, so they never got a pap smear. Also at that time, there were 3 doctors and only 3 doctors and 3 family islands that were doing pap smears. Dr. Lincoln in Long Island, Dr. Bacchus in Eleuthera, and Dr. Lundy in Abaco. And of course, when you had any condition related to pre-malignancy or even early malignancy, the only treatment we had was surgical. So we did a lot of biopsies, cone biopsies, and of course, hysterectomy. For those with advancing disease, we send them over to Dr. Leonard Tunkel at Mount Sinai in Florida for radiation. And we got a lot of spectacular results. Like the lady I mentioned, who's 37 years ago, and she's still around. So I joined the Cancer Society, and it opened my eyes to a lot of things. First of all, when I managed to travel there, few of the family islands had a doctor attached to the clinic. If one was present, they were often overburdened with dealing with everything and everybody. And of course, didn't afford the opportunity to do pap smears. And of course, if they did do a pap smear, those are the days of the slides. They'd pack them up and they'd wait for when they were shipping. And of course, a lot of them got lost, either getting to NASA or the report getting back to the community. Salvation came in the way of the Cancer Society, who started educating and screening. And of course, we did these weekend trips. Limited, but effective, especially in educating people about what a pap smear was all about. And of course, we did pap smears and breast examination. Later, they started doing prostate examination and PSA testing. Now, back then, even when we went out, the patient had strong reservation about confidentiality of the test. And of course, a lot of them didn't want the test done because they didn't want the local medical personnel to know what the results were. And of course, many were ignorant of the need for testing. And some of them just didn't want to know. And whatever treatment you gave them, it had to be a one-shot treatment. And it had to work because very few of them were ever going to come back. And so people who we biopsied and, pro or con, many of them never returned. I mentioned this, you saw this already. And so if a test was done, if you get a test done, you must know and get the results in a timely manner. If normal, you need to know when the test should be repeated. And if abnormal, you need to know treatment, the options, repeat when, and of course, treatment, biopsy, conservative management, vaccination, et cetera, But again, a lot of people get the pap smear and they tell me, well, if it was abnormal, the doctor probably would have called me. We need to stop that, all right? And a pap report often presents like this: normal, abnormal, inflammatory changes, abnormal dysplasia, CIN1, CIN. And as you go down the list, that's approaching malignancy. And of course, suspicious for cancer, in situ and invasive. And of course, I'm not gonna spend a lot of time on the treatment of invasive disease or anything like that, because I think we need to look at treatment. As I said before, cancer of the cervix progresses relatively slowly, takes often 3 to 10 years, and the progression is often predictable. So if you get an abnormal pap smear repeated and it's advancing towards cancer, you can literally measure the steps. And most pre-malignant lesions are treatable with more than 95% success. So, and of course, for a lot of these people, they just need to continue doing the pap smear. They have no sequelae of the disease. In 2006, we had the onset of the vaccine, and this was one of them, Cervarix. And of course, you get Gardasil 4 there. Now we have Gardasil 9. Now, as I said, COVID pandemic will limit how people accept these diseases. And despite all the efforts that I have had, I get very few people in my private clinic to get the vaccine. If I have given 10 vaccines in the years I've been practicing, I've done a lot. As a matter of fact, most of the ones who will accept the vaccine are the ones who have been diagnosed with abnormal pap smear, been colposcoped, biopsied, and it shows some abnormality. And then they will accept the vaccine. But in general, they're not ready to get themselves vaccinated. Because one, most people, first of all, don't think they're going to get cancer of the cervix. And of course, the issue now with vaccination is up for grabs. This is a slide I borrowed from one of the presidents. You can see the Cervarix, which is probably not so popular anymore because it only treated two of the viruses, the 16 and the 18. And again, the Gardasil, both the 4, which is probably now replaced by the 9, and you can see that it gives you better coverage. But again, you can see the age of when it's supposed to be prescribed. Age 9. So you can imagine you telling a woman you're going to give her 9-year-old daughter a vaccine to prevent cancer of the cervix. That's after you tell her that cancer of the cervix is infection, cervical, and often due to sexual activity. Okay? So, the pediatricians probably stand a better chance because they give a group of vaccines, so they'll be able to cover that base a little better. And again, you can see it varies in countries, the United States and the United Kingdom varies a little bit. And if you look for the Gardasil 4, females and males in the US, and of course in the UK, only females got the Gardasil and stuff. All right. And of course, you can see the different HPV that they cover. So of course, you get to the point where you have these pre-malignant lesions, and of course, you need to identify them. Management, basically, you bring them in, you're going to do a colposcopy, you stay in the cervix, take a biopsy, and of course, you get a pathological report as to exactly what's going on. And of course, most of these can be treated by simply excision. You can cut the area off using a cone biopsy or a LEEP procedure, or you can freeze or burn it. And often simply doing these, remove the lesion completely. And these people only need to be followed up. This is virtually what a colposcope look like. Using a microscope, you stay in the cervix. And of course, again, the detail of this, like I said, when I was preparing for this, I thought that this is probably when you get into this area and zone, you probably had missed the boat. So what we want to do is go back. So less people will be having this. But you need to understand that when you get to this point, it's not the end of the world. A lot of things can be done to reverse the process. And again, this is what, again, I show you what the cervix look like, and you see the biopsy. You take a bite out of it, send it to the lab. And this can be done in the office. You don't have to go to sleep to do this. And of course, these are the reasons for doing the cone biopsy. If you can't see the entire transformation, remember I said the cancer begin often at the zone between the squamous cell and the endometrioid type cells. And of course, when you do a pap smear, you use the brush, so you should be getting cells from the canal itself. And of course, if that showed dysplastic changes, maybe the reason for doing it. And again, cone biopsy often done in the operating room, but you can do it with the LEEP, which can be an outpatient with a little bit of sedation. And I mentioned this before, removing the lesion, precursor lesions. Now, these are not cancers. These are the precursor lesion to malignancy. Cryocardiac freezing, tarring, refreezing, colposcopic laser therapy, using low and high-grade lesions, LEEP. And you always need a follow-up pap smear and continued observation, because even though I say most people will recover completely from this, it doesn't apply to everybody. And this is what the LEEP look like. It's an electrically charged, and it cuts through almost like using a hot knife through butter, very quick, and often with little bleeding. And you can see the area of the cervix that's taken off. Now, this slide is put in because one of the things that you need to recognize that, even though you have been treated, this is often the age group where you get the diagnosis of cervical and other genital cancers, okay? And so you may have had a lesion removed when you were 30, all right? You become 50, 55, and then, because you have not been testing, remember the virus never goes away. So, if your immune system doesn't clear it, it's gonna hang around. And so you can be what you call, people often say you're in remission. You never had a malignancy then, so, there's not much of a remission, but the disease process can continue itself. And sadly, this is what we see in sometimes in elderly women, people who have, retired, lost their husbands, partners, and are no longer sexually active, so they don't see any need to get tested. I make a joke of this. One lady said, "This for Jesus." So, all right. So, you have to encourage them that you still have to, even though it's for Jesus, you got to get a look. All right. So if you see a lesion, it must be biopsied. And of course, it must be staged. And I won't go into the detail of staging. And cancer of the cervix is spread by lymphatic and direct invasion. And of course, again, this is, when you get into this, you got the whims and fancy of the gynecological oncologist, and they'll explain the detail. But you don't want, what my job this evening is to try to get people not to get to this point, all right, by just lending themselves to the screening and getting diagnosed early. And again, I go back to the same thing. And this slide again is just to show you again the different stages of cancer, all right? This is the early stage, it's confined to the cervix. Sometimes simply cone biopsy leap can get rid of this. Surgery works pretty good in this. You get a hysterectomy, you may need nodal dissection to see if it has spread outside the ear of the cervix. And this is just a little bit more detail. Stage 1 is in situ. A leap or cone biopsy secures this. There's no stromal invasion. And often the lesion is not visible with naked eye. This is stage 1 when obvious lesion. There's the lesion correspond to certain size, and that give you the measure. Stage 1, A1, A2, and et cetera, et cetera. I won't go into the detail, but again, you can see what is at stake. Stage 2 is when it certainly begins to spread outside, get into the pelvic sidewall, but not touching the pelvic sidewall. Stage 3 is again, you get touching the pelvic sidewall, the tumor may be extending down into the vagina. All right. And of course, stage 4 is when it spread all over. All right. And so again, I want to discourage you from putting yourself in the position that any of these stages and diagnosis will ever be made on you. What is the personal impact of getting cancer of the cervix or, having an abnormal pap smear? There's certainly a cost for the treatment. Of course, it can disrupt your income. You probably have to take some time off, questionable medical insurance. Where do you go for treatment? Family support, community job support, religious church and stuff. And there a lot of people sometimes opt for the wrong thing to do. They say, well, I really don't want any treatment. I'm going to go and pray about this. This is probably not a good thing to do. Pray, but also go and get the treatment, because the combination treatment is often better than the single treatment. Now, I know there are people out there saying, well, I know a lady who had this. And whenever I hear that, I challenge them. I say, give me the name and the address of this person and the telephone number so that I can go meet this person. And often when you do that, you get the response, well, it's not really my friend, but she is my sister friend who married to the taxi driver from Exuma, whose sister lived down in Inagua, who took the bush and went to the church, and the bishop blessed her, and you never meet the person. And so this is the story. Even with cancer, 5-year survival, early stages is pretty close to 90%. If you get stage 2, stage 3, and even some people, fortunately, not everybody have the same outcome, but 5-year survival is often about 60 to 65%. And of course, increased risk for developing secondary cancer and other chronic disease because you're aging. In environmental factors such as diet and physical activity, there's some benefit to that. You stay active, you stay healthy. And people who are positive in their approach tend to do a lot better than the people who are negative. These are things that I put in because a lot of times these things are entertained. Quit smoking. If you can lose weight, fine. Dietary changes, physical activity, then that's good. Treatment option depend on the type of the cancer and the stage of the disease. And of course, their patient's wishes. And of course, access to available treatment. Now, people jump on the plane sometimes. They jump and they go to Miami and they go up to Atlanta. They go cross country to Texas and even as far as Utah for treatment. Now, be careful when you do this, because sometimes some of these people that you meet are not necessarily the kind of persons who can treat your disease, but they quickly identify you that you're from the Bahamas. And most of the time, if you don't have good insurance, you have cash. And trust me, they're going to take every penny from you before they send you back to the Bahamas. Before you go, I often recommend that you find out exactly what your disease condition is. And even though we're talking about cancer, this applies to every cancer. What are the treatment options? Some things may be so advanced that conservative management observation is probably the best thing. Conservative palliative. Of course, simple procedures versus radical, more extensive chemotherapy, radiation, immunotherapy, and of course, combination of all of the above. And this I just put in, like I said, I never intended to have a full discussion on treatment tonight, so I'm not going to go there, all right? Surgery is to remove the tumor to the best. You can't cut across cancer, so you got to remove the entire tumor. Radiation, again, can kill, or sometimes you use radiation to shrink the tumor, and then you can do the surgery. Sometimes you do the combination of surgery then radiation. Again, radiation simply kills the cell and stop the growth of the cancer. Doesn't always work 100%. Chemotherapy is the administration of drugs, nasty for most people, and again, often used with many cancer treatment. They use it sometimes as adjuvant therapy, help to destroy some of the cells, shrink the cancer so that they become more amenable to surgery or radiation. And of course, it often stops the spread to other parts of the body. Of course, whenever you get cancer, you want to stay active. And these are, again, another wide spectrum of what I showed you earlier. And of course, there's some people, sadly, only palliative therapy is going to work for them. So you need the doctors, the nurses, the chaplain, social worker, counselor, psychologists, volunteers, farm therapists, and of course, it takes a village. So, the Cancer Society is a good place to come, find out. We have a center here that lends support to people. We offer accommodation and first-class encouragement. For some people, they want no treatment, and that's a real option for some people. But if somebody is I think it's important you enhance to them what type of cancer they have on the stage so that they know. Because a lot of times, some people say they don't want any treatment because they think the cancer and the present medical condition, physical condition is going to remain the same. And so they wait 2, 3, 5 years. And then when they realize that this is not what it's going to be, then they wish they could go back to the day when they turned on the treatment. Of course, there's physical impact of the disfigurement, things like people cancer the penis, cancer the cervix, sexual habits probably have to change. The people with strong religious belief who thinks that religion alone will save them. And there's nothing wrong with that. If that's how you want to go, I think it's fair enough. And of course, the cultural influence, social bush alternative medicine. I have not seen it work. And until that day comes, then I can't really recommend merengue, aloe, or any of the above. And of course, costs of treatment can be way beyond. In other words, you work all your life, you get one of these, and it completely destroys your life, your budget, your savings, and everything else. So the way forward essentially is we need better access to screening, we need effective reporting, and the issuing a report. People must know what their test results show. And of course, when you get the test result, is it normal? You just move on, get repeated testing at the proper time. Of course, the treatment option, if it's abnormal, costs, social, financial adjustment, and of course, follow-up for every section of the thing. So in summary, early detection often leads to effective treatment, better outcome. Need an annual physical, not just for a pap smear, but you need your breast examined, you need your blood pressure check, you need your diabetic, the sugar, cholesterol, etc., etc. And of course, awareness, knowledge, and information goes a long way. And this is just a slide that I found at the end with the vaccine. Again, like I said, I'm waiting to see the impact of this in our community. So in closing, live life fully to the end. And thank you. And I open for questions.
Okay, we have a few questions were asked in the group, and I will read those for you. But just before I do, and in case people sign off before we get to the very end, at the beginning I did miss some of the birthdays and anniversaries, so I just want to read those out. Jenny Lee Roll, anniversary on the 25th of January. Carl Delancey Roxbury, birthday on January 9th. Cheryl's birthday this Sunday, January 21st. And there were lots of anniversary greetings for you, Dr. Bloomfield.
Thank you.
So the first question was asked by Anna, and her question was, at what age is a pap smear not necessary?
Okay. This is an interesting question. If you are no longer sexually active and you have had what is considered, never had an abnormal pap smear, I think at 65, you can shut the door. But I would prefer for you to leave it up to the discretion of the physician who is looking after you. Because like I said, one shoe doesn't fit everybody. All right. And all right. I've been in the business for a long time. So because I can ask questions that other people probably can't. And so I ask genuinely, you sure you're not sexually active anymore? Oh, well, once in a while. You understand? So, all right. Is this the same person? Well, my husband died 10 years ago, and, I had sex once since then. So the thing about, if you genuinely stop having sexual activity, then the answer is you can stop really at 65. All right. If you have had an hysterectomy, again, if you have had normal pap smears, then you probably don't need to get a pap smear, but you need to get a pelvic exam. You need to take a look inside there to see what's going on. Cancer of the vagina is extremely rare, but there are other areas on the genitalia that you can get, on the vulva, around the anus, the urethral opening from the bladder. And so you need to take a look. So I would recommend that even if you have had a hysterectomy, whether you're sexually active or not, I would still make sure that as part of my physical examination, that I get a pelvic exam done. And the pap smear, the stuff that you take to the lab, becomes optional.
Okay. We have a question. Does the pap smear conducted include the HPV testing / co-testing?
Yes, most of those are done in typical now it is, but the detailed testing for HPV viruses on a pap smear often encompasses additional charge. So you don't need to do this every time you do a pap smear, but at least once, so that in other words, if you have a negative pap smear and there's no sign of the HPV virus, then it sort of comforts you in the fact that you're probably at very low or almost no risk within a particular period going forward. But you can get the testing. It can actually identify, and more so the viruses that are the numbers that can lead to cervical cancer, the 16, 18, 35, 31, 45, those can be identified. They call them the high risk group.
Okay, you have a message here from Dr. Shea, and I'll read it for you. Hi, Dr. Bloomfield, great talk. Good to see you back involved with the Cancer Society of the Bahamas. As you told me, you kept to your word in that you returned to be involved with the educational aspect of the public that the Cancer Society is involved in. And we all thank you for that. He goes on to say cervical cancer screening rates remain too low. We have lots of work to do. Vaccines, unfortunately, had never caught on. Needle phobia and the recent COVID vaccine hesitancy has not helped. We still need to push it. Continue your tremendous contribution you offer to the Cancer Society and the Bahamas. And lots of people supported that comment. So thank you, and we do encourage you to keep up your good work that you're doing. Juanita Pinder said, excellent presentation. Thank you very much from Violet Stewart. Dr. Holliday also excellent presentation. So you see how much we missed you, Dr. Bloomfield?
I'll be back again, like I said. I see there's a tremendous need, and to all the people who send me wishes, Dr. Shea, Dr. Holliday, Juanita Pinder, and Elutra, it is my esteemed pleasure to be part of this. And I thank you for the support, the things that, Dr. Holliday, I was just watching a presentation you did in 2015 on YouTube. So again, I have all of these things still stocked away. And, it was because of your talk on YouTube that I went back to look to get those numbers, where I realized we're doing far less pap smears now than we were doing back in 2015 and in the early 1990s as well. So, thank you very much for the kind remarks.
There's also a comment. Thank you for this information. I don't know if this is Dr. Halliday. It's the HPV Vaccination Roundtable. The comment is, thank you for this information. Great presentation. I would have liked to see more discussion of HPV vaccination could prevent more than 90% of cancers caused by HPV from ever developing. In the UK, they're almost near an eradication of cervical cancer through a focused effort in the last on vaccinating adolescents starting at 9 to 12 years old.
Okay, I restricted my comments in more detail because, again, the vaccination has not caught on, and people have to be willing to be vaccinated. In other words, the pap smear is a little bit more intrusive, and I can probably understand why people, are reluctant to get a pap smear. Vaccination to me should be, we all grew up getting vaccinated, and we certainly, people like me, past 70 years old, we have benefited from having been vaccinated. And it's really crazy to think that there are people today who are not offering vaccinations to the children. So we're probably going to see things like polio, measles, mumps, chickenpox coming back again. And these things they kill children. So I know the detail of the vaccine, but again, like I said, if we only get of the number 137,000, and we get less than 11, 12,000 people being popped each year, are we going to get 50,000 vaccinated? I wish that would be the case, but until we get that, people understand the nature of the HPV and the risk of cervical cancer and other cancers related to the virus, then we can push them. And of course, we also have to get them to forget about COVID and the COVID vaccine.
Yeah, that's a big one. Dr. Bloomfield, I recall when I was younger, much younger, in school, primary school, and they used to, every year, they would come around to the school and give the polio and the other thing that had the 4-prong needle. I forget what it was. But so has any consideration been given to doing something like that through the school system?
You mean the HPV vaccine?
Yeah.
Yeah, well, I think, the Ministry of Health, the government of the Bahamas has to really put this into consideration. And it's going to take more than simple us at meetings like this trying to get people to, we need the hierarchy to let people appreciate that this will be highly beneficial to them, not just short term, but certainly long term. Imagine if we could wipe out cancer of the cervix. Like I said, I've had so many clinical experiences of people who have undergone the impact of cervical cancer. We had a nurse who worked in our clinic who used to put the patients in the room, and she never had a pap smear, and she died from cervical cancer. I mean, how much more damaging that can be? I had to go and see her. And I was almost tempted to say to her, why? But I couldn't.
Yeah.
So.
Good night. I have a question. At what point? Good night. At what point do you stop taking if you have you had a full hysterectomy? When do you stop? What do you do?
Okay, I go back over that again. If you have always had normal pap smears, okay, you basically don't need another pap smear if you are involved with the same sexual partner. But you must be that person's only partner as well. Now, I don't know how many people can guarantee that. And I say this on both sides, men and women. I don't want to feel that I'm bashing men, right? Okay? So the bottom line is, it's up to the discretion. I think you should leave this up to the discretion of the physician. Like as I said earlier, even if you don't get a pap smear, which is really popping, remember the pap smear is designed to look for cervical cancer. If you get a hysterectomy, and I'm glad you brought this point up, there are some people who are now opting to have what we call a subtotal hysterectomy, where the cervix is left behind. So the cervix is still there, and it can still be affected by the HPV virus. So you need to know, as the people said, whether you had a partial hysterectomy or a full hysterectomy. If you had a partial or subtotal hysterectomy and the cervix is still there, you still fall under the guidelines of the pap smear. Again, if you had a total hysterectomy, I would recommend that during your annual check that the physician at least do what we call a pelvic exam. Put the speculum in, look at the top of the vagina, just to make sure that everything looks normal. Cancer of the vagina is very rare unless you probably had a cervical lesion that lingered on and is now infecting the vagina. But the vagina can get cancer. Very unusual, but it's possible.
There's a question. Is there any other way to have a less, I'm muted, okay. Is there any other way to have a less invasive way for testing?
All right. Newly, they've now suggested that they have these kits where you insert a swab-like structure into the vagina, and you package it and you send it off. Has not really proved its worth yet, and it's still, to some extent, experimental, even though it's being used in certain areas. The bottom line to that is you trust in that you know exactly what you're doing, that you're doing it right, and the report that you get, that you're also going to respond appropriately to the report that you get. So up until now, the pap smear, the intrusive pap smear, once a year, 5 minutes procedure is still the best thing going.
Okay, so that's looks like all of the questions in the group that I saw. But I don't know if anyone else in the chat has any other questions. Okay, so looks like that may be it.
Madam President, permit me to say something, please. This is Juanita.
Sure, go ahead.
Thanks again to Dr. Bloomfield. And when I look at those statistics, I am just shocked to see that the rate of testing, instead of it increasing and getting better, it's getting worse. In this day and time, when we have all of this information that is so readily available, we are doing worse than we should be doing. And a presentation like this, Dr. Bloomfield, I don't know, I think we need to take this national, because this definitely is some good information. And I learned a lot tonight. Even though I've heard you speak on this topic, I learned a lot tonight. And on Eleuthera, we have some testings coming up on free clinics coming up on the weekend. And God knows we try so hard in these various clinics. Some clinics do better than others, but we definitely need to do better, because, you know, we as a people, we chase the horse after it's gotten out of the barn. And we spend so much of our resources fighting cancer when we could be helping people to get this information before they get to the point to fight cancer. So I think we need to take this national, on the airwaves, the television. So Doc, get busy. Yeah. I know you're busy, but
no, I'm fine. I hope you don't mind me calling you Juanita. We're close friends.
Definitely.
I've been out of the loop, and again, you know, I know there are doctors who actually come to Eleuthera now. All right, there are doctors who come on to these private clinics, so the number should be at least 3 times what you did 10, 15 years ago. Doctors going to other. Then we have 5 major clinics in Nassau. We have major private clinics now. We got Doctors Hospital, Oak Tree, you know, walk-in. And so these numbers ought to be going. Now we also have NHI. And a point I want to make to the people with NHI, if you're going to be going to an NHI physician, make sure that your needs are going to be met. In other words, sign up with a clinic or a physician who will do all the things that is necessary for you. So if you're a female and you're under the age of 65, then that clinic, that physician ought to be able to do a pap smear and give you a report in a timely manner. Okay? Not just do your blood sugar and your blood pressure. So I would recommend that you search that out. And I'm not bashing people. It's just a reality. If the numbers continue to decline like this, the vaccine doesn't take hold, then, and especially we had a 3-year lapse with COVID. Remember I said take 3 to 10 years? So there are people out there now who have not had a pap smear from 2019. This is probably now the 4th year. And they're trying to catch up now. So those people who probably had normal or early changes may now be on the edge or the precipice of having pre-malignant or malignant disease now. So we need a lot of catching up. Lots and lots of catching up. I hope that helped.
Several persons were asking for the recording tonight's meeting. It is recorded, and you can visit the Cancer Society's Facebook page for the YouTube link to get a copy of this presentation, and share it with your friends, or refer them to the site to see it for themselves. It was very good information, and information at a level that I think a lot of people could really relate to and understand. Sometimes the jargon is so high tech, we don't always get it, but I think we all got this tonight. Like Juanita said, those numbers are staggering. I mean, totally unbelievable. So thank you so much for sharing those with us, Dr. Bloomfield. Like Dr. Shea said, we have a lot of work to do, and we at the Cancer Society are going to try to do our part. Education, awareness, early detection, that's the things that we're going for. So thank you so much for sharing with us this evening. And it's so good to see you again, Dr. Bloomfield. And I am looking forward to seeing much more of you. And so is everybody on this group. We had over 80 persons at one point. We haven't seen those kinds of numbers in a long, long time. So you're a crowd gatherer for us. So thank you for coming out. And thank all of you who came on this evening. And we hope we'll see all of you again next month and in the months to follow. We'll promise you that Dr. Bloomfield will be back. So stick with us.
Thank you very much. Have a great evening. Happy New Year to everybody.
Yes, I say the same thing. Thank you all for joining us. We look forward to doing lots of great things in 2024. And we look forward to doing them all with all of you. So thank you all for joining us. Have a wonderful evening. And our next meeting will be February 13th. So that's the night before Valentine's. So you don't have the excuse to say, well, oh, I was out for Valentine's. So you can come out to the meeting on the 13th and then go and enjoy your Valentine's the next night. So we hope to see you all. I hope you all stay in good health and be blessed.